Yeah, I'm gonna, apologies to interrupt, but I know we have a lot of questions.
Yeah.
I want to make sure we can get to them. And so I'm gonna jump right there. The first one, perhaps for Steve as well as Matias, it's from an instructor, and the question is about training skills. There are a few skills where you need to hold your student while doing those. Given COVID has impacted that and the need for distancing, how are you advising advising your divers around doing or training on some of those skills? And then I think the question to Dan was, has Dan thought about how it incorporates COVID into its overall insurance? So Steve, perhaps we start on the skills.
Shall I go first?
Yeah.
Overall, the protocols really boil down to, first of all, ensuring as far as you can that no student is expressing or presenting signs of COVID. Everyone's feeling good. No one's sneezing. No one's got a headache, etc. So that's part of that's the first step. Second steps, of course, are mask and social distancing when you're doing briefings. And when we talk about sanitation, of course, the obvious one is equipment, but let's not forget surfaces in classrooms, et cetera, et cetera, et cetera. I think the question was specifically about skills in the water and being in close proximity to a student. And this is where our medical consultants were slapping my wrists, because certainly we can make sure that we don't actually exchange equipment. There are protocols, there are ways around that. But you're quite right in thinking that if I'm teaching someone, especially at a basic level, I might want to actually have physical contact with them. Once you've sort of got in the water, you can't guarantee that the water, unless there's enough chlorine in there to kill everything, including us, we can't guarantee that the virus will not survive at some point. So one has to take a measured risk. If you're going to teach, if you're going to have physical contact with a student, which if you're going to teach, you probably are, you have to accept, and they have to accept, that risk. Holding a piece of equipment, if you need to hold on to something, there's probably a very, very low chance of cross-contamination at that point. So it is possible to teach. It is possible to have contact. It is possible to actually, with some modifications to some of the drills and some of the skills, it is possible to actually teach a class and keep the risk of cross-contamination, cross-infection very, very low, supportable. We cannot eliminate it completely. We have to be aware of that. The start, and I can't emphasize this too much, is to make sure that when people come into the classroom, when people come into the group, that everyone is sure that someone could have the virus and be asymptomatic, but no one is presenting symptoms. That's the first and the key thing. When we debrief, when we're back on the surface, again, social distancing and masks. Not scuba masks, but quasi-surgical masks covering our nose and mouth. And one other little thing. We're a global agency, and we all work for agencies or companies that have a broad reach. The situation in Canada is very difficult to the situation in, say, California. The situation in Singapore is different to the situation in Australia. Monitor your local health experts. When in doubt, speak to someone at DAN or the equivalent, but DAN is our default. Give you a bit of a plug there, Matias. And make sure that you conform to best practice. And you know, if someone comes up with a really novel idea on how to actually teach buddy breathing without cross contamination, hey, you know, like, let's do it. Just the fact that it comes from SSI instead of RAID, hey, we don't care as long as it is supportable and it is backed up and can be cited by as a credible peer-reviewed source. That's the best I can do.
Yeah, I'm gonna take the second half of that question and actually roll it in with a lot of our questions, and this will probably be the last question that we have time for. A lot of our questions, Dr. Matias, have been around how do we learn about updates and diving recommendations, sort of the latest research. Many people look to DAN as that platform. Is there a platform to learn from? I think a lot of questions have come in around, I had mild symptoms. How do I know? What are the types of medical tests that I should be asking my doctor to help me with? Should I not go very deep on my first dive? Does my DAN insurance cover me for COVID-related, health incidents? And so I think they all cover a similar theme, which is recognizing that we're still early in the process of learning. Where do people go, or where can people go to learn about the latest and make sure that they're well informed?
Thank you. Yeah. First wanted to say that, Steve, you actually nailed it. I mean, the risk is there, right? The risk is there, and the risk has been there for a while. I mean, body breathing used to not be a problem, or at least it used to not be an acceptable risk, and now it is. So things have to change, and we are adapting, and I think that we think the training agencies are doing a great job. Things need to evolve, and there are things that we used to do that they may not make sense anymore, or they pose risks that we're not willing to take.
Yeah.
So that's it. I mean, Dan, together with actually our risk mitigation team, has done a fantastic job in trying to compile sensible answers and doing the research that is necessary to give back to the industry on how to not get away with this, because we can't, but again, minimizing the risks. So we encourage everybody to go to dan.org/COVID-19. Okay, so that is dan.org/COVID-19. So we have there recommendations for dive operations and COVID, how to prep for return, and then first aid training recommendations and surfer survival times, right? So Steve, you were just talking about that, of contaminated objects, because again, you nailed it. We don't know who is sick and who isn't. That's why we ended up in this pandemic, because asymptomatic people can infect, right? So you have to assume that everybody is sick. That's why we're using face masks. So when you're touching or manipulating potentially contaminated objects, well, there are things you can do to try to minimize the risk and wipe them with solutions that, like Tanya was saying, they're going to be effective in killing or inactivating this virus, and at the same time not damaging the equipment. So again, I highly encourage everybody to go there. Our risk mitigation team did a fantastic job there. In terms of the medical issues, we talked about that before. If someone has had COVID, well, give the medical team and the medical industry, the medical experts, a break. They're busy now with dealing with the pandemic. And if you have had a mild case and you don't have a reason to suspect that your lungs are in bad shape, because you didn't require hospitalization, because you never had a shortness of breath, and you were never that sick, your respiratory symptoms were minimal or non-existent, well, based on what we know now, there may not be a reason to freak out, right? And if you're concerned, well, if in doubt, don't do it, right? And if you're going to do it anyway, well, take it easy at the beginning. Initially dive in very predictable environments, with supervision. Don't stress yourself. Don't do that deep dive that you've been planning forever, because this may not be the best time. But that doesn't apply just for COVID. Every time you have had a significant change in your health, when you go back to normalcy, you need to take it easy. You need to take it step by step, and not just the first dive easy and the second dive just back to normal. No, a good couple of handful dives or dozens of dives, gradually increasing the demand, gradually increasing the complexity. And always, people, keep in mind that sometimes the best places to go diving are not the best places to get sick. Okay? So,
Yeah.
so when you go diving, if you don't know if you're going to need medical assistance, make sure that if you need it, that medical assistance will be there. Yes, you have done insurance, but we can't rescue people from the middle of nowhere and in no time put them at Mercy Hospital in Miami. It takes time and effort. And during a pandemic, guess what? Evacuation resources are limited. So keep that in mind as well. There were some questions about insurance. Unfortunately, I can't answer that, even if I have the answer, which I don't. It would be illegal for me to answer insurance questions. So please call us. That is 919-684-2948, or just send an email to dan@dan.org. It'll get to the right place, and we'll give you the answers that you need.
That's fantastic.
Yeah, other than that, on this webpage, dan.org/COVID-19, every time we have a new question that we feel it's worth putting back, we craft it, we give it our best shot. I can't tell you how many times we review, we reread, we recalibrate to make sure that the message is well sent, that we're not missing anything. We're extremely obsessive with when something is out there, it's because we really feel it's ready to be out there. We don't take these things lightly. We try to be very diligent and very responsible with what we put up there and how we put it. So if there's something new, it'll be there. And we make use of the social media networks to get the message across, and we'll most likely always be putting stuff regarding COVID, at least there. One last thing that I wanted to say is one of the positive things about COVID, if there's anything positive, is it has given us the opportunity to look things in a different way. Right now, everything is COVID, and we're all obsessed about COVID. Hopefully, in the future, COVID will not be an issue anymore. Still, we would have learned on many things on how to prevent transmissible diseases. This is a huge impact for us in our industry, particularly when we think on liveaboards, right? So can you imagine that if this disease had the effect it had in a city like New York, right, where it was shown how in a matter of weeks, everybody was sharing the same germs, right? Now, think about that on a liveaboard. Okay, so again, this is an opportunity. We think that there's a lot of space for improvement all over the place, and we're going to be there giving our 2 cents to make sure that we do the best we can with the resources we have, with the knowledge we have, and to try to understand what the industry needs to just keep going.
Fantastic. I know we're a little over time, so I'm going to wrap us. I want to start by just thanking all our speakers for sharing their perspectives. I see comments in the chat about this being useful and informative, and I think particularly the latter, very, very informative, and appreciate everyone spending time bringing your perspectives. A few requests around a recording of this webinar will be made available after the fact, but thank you everyone and have a fantastic day.